read pharmakeia, and it means pharmacy. What is pharmacy? The art and science of preparing and dispensing drugs and medicines. That's what it means. That's what's translated as sorcery is here. And it says, by them, by the pharmakeia, were all nations deceived. In those days, they used to say that doctors don't have a lot of money. Why? Because they treated you, they wanted you well. They were taught not to go after money. But the world has since changed. So Big Pharma also wants money. And how are they going to get it? They don't get money if you don't get sick. So the more sick people there are, the more money they get. So those who are thinking that they're somehow trying to help the world, no, you're deceiving yourself. Especially, I feel sorry for the professionals, because they're so honest. You know, the professionals they're trying to do their job. I'm talking about the doctors and the pharmacists who are professionals. I really feel sorry for you. Because, you know, you're just somehow honest and trying to do your job, and you're using the data that they gave you. You're using the data. I mean, you didn't do any research to come up with data yourself. So you're using the data that they gave you. After all, how many doctors or how many pharmacists are coming up with their own inventions? No, they're not. They're not. They get a document from the CDC or the Ministry of Health in their country. And that's what they get. And then they tell them the regimen for the medication of some kind. And that's what you get. And so you use that information. Doctors don't make drugs. I want you to hear what I'm telling you now. This is important. Doctors don't make drugs. Doctors treat people, they try to cure, but they don't make the drugs or the equipment that they use. They don't fabricate the equipment, and they don't make the drugs that they use. So they listen to two groups of people. I want you to listen to this, very important. The doctors are trained to depend on other professionals for their job. Number one, they depend on the pharmaceutical industry, who creates the drugs and sends them the drugs and the documentation. So the doctor, he don't know nothing about that drug, but what the pharmaceutical company says is on the drug or in the drug, or what the drug is about. So he takes that documentation and he reads it. He don't care what they're talking about. All he cares about is they said this is the new drug for this particular treatment, and so he recommends it to his patients. So when you say you talk to your doctor, ask yourself, what has the doctor been listening to? The second group of people, or the second group that the doctor listens to, is the health regulators. So the regulators say, we no longer use this particular drug. From 2012, you don't use this anymore, you use this. Whatever the regulators say, this professional doctor follows. I want you to understand, the doctors, they don't do any research on the drugs. They really don't. They follow the instructions because they want to keep their job, and so they follow what the regulators tell them and what the pharmaceutical industry tells them. Period. They don't make the drugs. The toothpaste that you use every day. Oh yeah. The inclusion, the smart, devilish inclusion of fluoride.